All right, so you can see now her temples. You see the left temple and the right temple. The issue with the temples is that there's a number of danger zones that are there. And the most important one is the area of the superficial temporal artery. So there are borders in which the temples have to be taken care of. First of all, the temple itself is divided into certain parts and is bordered by, from the front, the orbital rim. From the upper part, it's the temporal crest, or the temporal fusion line. From the posterior of the temples that you're able to visualize is the hairline. However, the temple itself, if you look at the skull, is huge and goes all the way back to the occiput. Okay, but what you're able to visualize is bordered by the hairline. And finally, on the inferior side, it is the zygoma. So this is basically her temples. The major problem with the temples is that one of the reasons why it sinks downwards is due to the effect of, fat atrophy, in addition to changes to the muscles. So the muscular atrophy that happens with age. Sorry. Okay. But sometimes also with sports. Do you go to sports? No? Okay. I'm trying to fix something, but it's not working. All right. Then, but look at the bright side. Everybody gets older. The bright side is that you're a dermatologist and you can inject yourself with Botox all the time. All right. So that's what we're going to be treating. There are two ways in which you would treat the temples. A lot of people will tell you that the best area to treat is to come in from an area where the orbital rim is about 1.5 to 2.5, and then you draw another line basically going upwards. So this is basically the area in which you would want to treat your temples. The reason why they chose this area is that this is an area in which the superficial temporal artery is not there. In addition to, is that the skin all the way down to the periosteum, because that's, if you're going to use a gunshot technique, you have to hit the periosteum, is going to be of least amount of space. That being said, the problem here is not injecting here. You can still inject here. Personally, I inject here, I inject here, I inject here. Because if I inject here, do you know how much product I would need to inject to cover this whole area? A lot. It's going to be a lot of product. So personally, I would come in the center if I'm using a gunshot technique and I would inject here. Everybody would say like, no, you cannot do that. That's a danger zone. You're going to hit the superficial temporal artery. Yes, you will if you're using a short needle. The needle that comes with the blister pack, with the filler, is short. So in this case over here, you would want to switch to a needle such as, do you have a 25 gauge? Or we can use this one. Or for example, you would switch to something like this, or a 25 gauge needle that is long. As long as you are going in perpendicularly 90 degrees, touching the bone, if you touch the bone, it should not be an issue. Whether you are here, whether you're there, it doesn't really matter as long as you're touching the bone. It is called the superficial temporal artery for a reason. It is superficial. It is not going to be under the temporalis next to the bone. Okay? And if the person says like, why do we inject only here? The only reason here is that because the space is thinner and you don't need a long needle for that. And that's the reason why they chose this area, because it's safer that way. But technically, you can still inject the middle part. If you come in at a 90 degree and you go straight in and you touch the bone, the requirements for your filler is much less. You're going to require much less of filler material injected from here as compared to here. Because here, the whole area has to be covered. Here, just a simple amount and just simply massage it in. Okay. That being said, the easiest way to inject this is to come in using a cannula. If I'm injecting using a cannula, what's going to happen is that I'm going to be injecting something that is, first of all, softer. I don't need something that's heavier. And at the same time, I will require less amount of filler. Where would I come in? Feel the temporal fusion line, which is basically your temporal crest. And you can see it, the temporal crest is right over here. You create your little opening here, and then you introduce your cannula inside, and you inject this whole area with your filler. The filler of choice here is something that's softer because you're over the temporalis. If I'm injecting intense over the temporalis, every time she goes and chews, you'll be able to see the filler. If I'm not injecting something that's quite thick, something quite soft, You can definitely inject it with natural appearing results. So if I use this is a short needle. If it's short, do not inject this in the midline. You do not know if you're going to touch the bone or not. Here, with this one, you have to be in the safe zone. And that square that I showed you, that's the area in which you would want to use this needle. But I'm going to be changing to using a cannula. In her case, you can see the temporal crest. The temporal fusion line is very, very visible. But if sometimes you can't see it for certain individuals, what you would do is that you feel the temples, it's soft, go up, still soft, go up, very soft, going up, still soft, and then, it's bone. The minute you feel that there's more bone than softness, that's your temporal fusion line, which is right over here. And here, you create the little opening. And a small, just the tip of the needle goes in. Some gauze? No, can I have a dry one? Dry gauze. Dry. True gauze. Thank you. You create a little opening. This time I can see a little bit of bleeding, which is good. Go straight in. And you introduce your cannula inside. Perfect. You can see where my cannula is, and that's the level in which I'm going to be injecting. How are you doing? Doing okay?
Yeah.
I'm filling it with my filler. How are you doing? You doing okay? I'm using flux. If anybody's asking what am I injecting, I'm injecting flux. I've injected about 0.2 right now. Remember I told you why I like going up? You felt it? Sorry. I'll explain to you why I like going up. The same injection point, I can simply turn it and move it on her forehead. And now I'm in the forehead and I can inject her forehead if I wanted to. Okay? And that's the only reason why I would choose the upper compared to the lower. Good. Any pain? A little bit? Say the truth.
A little bit patient, I don't know.
You're a doctor, you're supposed to tell me exactly what you feel.
No, a little bit.
Okay. I've injected about 0.3. There's no way if I injected the deep using a gunshot technique, 0.3 would give me this result. Okay, I would need at least anywhere between 0.8 to 1 ml, maybe even more. But you can definitely see the difference between this side as compared to the other side. She still needs a little bit more here, so I'm going to inject her. I'm going to come back again. Injected 0.4. Perfect. Stop. And we'll simply this off. How are you doing? Good. The difference between the gunshot and this technique is that the gunshot technique, after it's done, 24 hours from now, the patient is going to feel pain. She's going to feel headaches, no matter with or without lidocaine. Because you're underneath the muscle, you're stretching the muscle. Once the muscle is stretched, what happens to it is that it will cause pain for the patient. And a number of patients have called me the next day complaining of this pain and wanting basically, something to be done for it. And in normal circumstances, a little bit of, paracetamol or a little bit of NSAIDs, something non-steroidal will really get rid of it. Good. Can you sit up? And let's look at the camera. And you can see the difference between this side, and she still has that little depression, and that side. Okay? And it's filled up. It's a little bit more swollen. However, this is going to go away completely with a little bit of massage. I will tend to use a cream at the end to kind of provide a little bit of massaging to this area. Sit up. Let's look at her peripheral fossa. So now that we treated this side, let's treat also the other side. So we're going to go back again to the other side. Usually I treat the right side before the left. In her case, I'm doing the opposite. So let's clean the peripheral fossa. Look at what's going to happen to the peripheral fossa. We're going to be treating it right here in the center. You go where the triangle is, that's the peripheral fossa. You go straight, 90 degree. You go deep. I've touched the bone. Okay, so you've touched the bone here. And then you simply start injecting your bolus. Inject very, very slowly. Always on the bone. Always on the bone. Never move your needle from the bone. I've injected about 0.2, 0.3. I would stop, come out, massage. I'm going to ask her to sit, and you're able to visualize now how her nasolabial folds have become softer on one side compared to the other. Okay? She's going to need a little bit more, so we're going to inject a little bit more. Same little opening. Go deep, touch the bone, and you introduce your filler. And then you massage. Any pain in this one? Just a bit?
Yes.
Sit up again. Straight into the camera. Deeper. Sorry. So you're able to see that the nasolabial folds here has become much softer than the nasolabial folds on the other side. In addition, there's slightly some elevation that's happening there. Let's have you relax. Very nice. You can use your flux in this area, or you can use your LV. So on this side, on the other side, I'm going to show you how to do the LV. You'll have the same results, don't worry. Go in, straight, touch the bone. Remember, touch the bone. Felt pain there? A little bit? Let's have you start. Which side looks better? The one that we just treated, right? So that tells you, so now you look at the differences between the G primes. Okay, so the G prime here, because we've used LV on the right side, okay, tells you that the best product for her case would be LV. Okay, so that's exactly what we're going to be doing. We're going to fix the other side now with just a very small amount. She's going to require a small amount on the other side. Relax. You're doing very well, my dear. Always remember, on the bone. Do not move over the bone. These little are disappearing. You okay?
Yes.
Almost done. I promise this is the last one. Yes? Any questions? I know. So the issue with, I'm going to be honest here, the issue with Novia is that, even though they don't feel the pain once it's injected, the minute you start massaging it, they feel that there is a filler there, right? When I'm massaging it, yeah. So it tells you that you have to be slightly more cautious with such patients. So don't really kind of massage very hard. I want you to sit up. See, without treating her nasolabial folds, we've lifted this area up. In addition, her cheeks, her mid-cheeks, without treating them, also have lifted upwards. That's exactly what the results what we're looking for. Okay, we've injected about 0.6 here, and we injected about 0.4 here, and we added a little bit of flux that was injected in that area too. Let's have you relax. Good. And now the final effect is that I am going to show you with intense LV, we're going to do it LV again, how to do the gunshot technique here straight up. All right, I just wanted to kind of give you an example of how the gunshot technique, I'm going to inject a very small amount of the gunshot technique. So the gunshot technique, you want to come? Okay. Yes, please. So with the gunshot technique, I'm going to just show it to you. You go straight, 90 degree, touch the bone. Did you feel me touch your bone?
Yes.
Yes, she feels me touching the bone, and then I will inject. You have to be touching the bone when you're injecting. So, my dear, maybe tomorrow you'll have a migraine.
Yes.
Just half of it will be gone, you'll have a headache. I've injected about 0.3 of this area, because remember, this area did not need much as compared to the other side. And then we will massage. All right, so let's get some cream on. So which technique now would you do? Would you do the cannula or would you do the needle for the temples? You got to see both. We'll ask the patient, which one was more painful, the right or the left?
In the temple?
Yes.
Same, I think. I don't know.
Okay, so both were the same.
Yes.
Okay. All right.
But I feel pressure and some voice.
Some voice?
Yes.
Here?
Yeah.
Okay. All right, and that's because this one was injected deeply
Yeah.
as compared to the other side. The results will
No
be...
pain.
No pain? The results will be exactly the same.
Yeah.
All right, let's put a little cream on. You have a lot of very hollow on the left. Let's put 0.1. All right, so we have another 0.6. What are you going to do with it? All right, let's relax. Let's put some cream on. Any questions from everybody? The last thing I want you to do is just, I want you to sit up. Just look at the camera. Look at the difference between here, and also the temples that we just treated.
Bu işlemlerden sonra antibiyotik veya antihistaminik kullanıyor mu?
Are you using any antibiotics or
No.
antihistaminics?
No, not at all. Let's clean up her cheeks. Explain? Okay. Let me just show you what I do when it comes to the cheeks. The way that I introduce myself with the cheek is that I will look at the lateral canthal line, orbital rim, and 1 to 2 centimeters from the orbital rim, I create my little opening. You go in, I've touched a little bit of the bone, and then I come out. Okay, there's hardly any bleeding. This point here, we just published it. If you guys remember, if you guys still know Wolfgang Redka. So Wolfgang Redka and I, we published this point here as a single entry point for the cheeks, also for the T-troughs. Relax, you're doing very well. Also for the T-troughs, and more or less pan-facial. So I'm going to put a very small amount just over here, because I just want to add a little bit on her soof to get rid of a little bit of her T-troughs. So that's 0.1. And then I go downwards to add a little bit on the deep medial cheek fat compartment to provide a little bit of elevation for her cheeks. The only, I would, for some patients, I usually don't, but some patients, if I tell them that there is maybe 0.3 or 0.4 left, and I would ask them, where do you want me to inject? And if they don't have any place, they would tell me, doctor, can we keep the syringe for later? I tell them I can keep it only for 2 weeks. After 2 weeks, that syringe gets discarded. I don't use it, I throw it away. So the patient has to be ready to tell me where he wants to be injected. Or I would tell him, I would recommend certain areas. So in her case, I recommended that we treat a little bit of her cheeks. It's just that the cannula is very big. Okay, finito. And we'll put a little cream. Yes. And now I'm happy because we got rid of all the filler. Nothing goes to waste. Now this area here is slightly a little bit, a little swollen, but it will go away, okay?
Okay.
And this area here, you might have a little bruise, just this point. Okay, so I'm gonna ask if you have ice, you can put a little bit of ice there, that's it. Okay, so just put it on that one. Okay. All right, we're done. Are we done in good time?
İsterseniz bir kamerada kendinizi gösterin isterseniz biraz.
Sit up. Ah, look at you, wow.
Ha, sağa sola
It's like a
dönelim.
different person.
Görsün insanlar da.
She looks at least 26 now. Yeah, even when she smiles, she's looking very fresh. Yeah, she still looks natural, but she looks fresh. That's what I like about it. She looks fresh. Okay. All right, good. Thank you. Thanks so much.